Time is an essential factor in combat rescue. Over 80% of the casualty deaths occur in the first 30 minutes. High-quality treatment, administered as soon as possible and during evacuation, saves lives. Our goal is to prevent the 25% of avoidable deaths. To reach this goal, responders must balance tactical considerations and medical issues. Combat rescue begins with instinctive actions taken by the casualties, him or herself, and his or her buddies. Secure the zone with armed retaliation. Shelter each casualty carefully during maneuvers that combine good medical treatment and good military tactics. Place a tourniquet at the root of a limb to stop bleeding. Apply pressure to external bleeding. Administer a shot of subcutaneous morphine. Combat rescue continues with the arrival of medics, nurses, and physicians. Safe March RYAN is an acronym the French Army uses to prioritize procedures and standardize immediate treatment. Awareness of the threat is essential, since 25 to 50% of the losses occur during rescue operations. SAFE accounts for security. Stop the fire, be aware of the threat and reduce it. Assess the scene. How many casualties are there? Are they accessible for evacuation? Free of danger for you? Do not take action unless the tactical situation allows it. Evaluate. Group casualties in a safe zone take a survey on their injuries and prioritize treatment. March describes the order in which medical procedures should be carried out. Massive bleeding control. Look for and stop bleeding from all external wounds. Tie, tighten, or double tourniquets. Apply gas packing. Airways. Clear upper airways. Settle conscious casualties in a half-sitting position. Place unconscious casualties in the recovery position. Respiration. Identify and remedy tension, pneumothorax. Use three-sided dressing to avoid occluding the chest wound. Circulation. Check the casualty's wrist pulse. Its absence is the first sign of hemorrhagic shock. Blood products must be administered, whole blood or cell concentrate, and French lyophilized plasma. If blood products are not available, administer crystalloids until a perceptible wrist pulse is obtained. Administer 1 gram of tranexamic acid intravenously as soon as possible. Administer vasopressors if hemorrhagic shock persists. Inject 0.1 milligrams of adrenaline or a syringe pump of noradrenaline. Hypothermia and head. Prevent hypothermia. Identify casualties with severe head injuries to prevent and treat secondary brain injuries. Evacuation. Evacuate casualties as quickly as possible. RYAN stands for the other important tasks, which must not delay evacuation. Re-evaluate the casualty constantly and fill out the field medical card. Eyes, ears, nose, and throat. Treat urgent functional conditions. Analgesics. Evaluate pain and provide relief with shot of morphine and ketamine. Antisepsis. Clean the wounds and administer antibiotics to prevent infection. Combat rescue and Safe March RYAN can also be applied to the civilian world. In a terrorist attack with firearms or explosives, combat rescue techniques can save lives. The main takeaway is to combine good medicine and good tactic. To achieve this goal, an immediate global response for police, basic life support teams, and medical teams is necessary, so that all victims can be assessed and then evacuated quickly and safely. Rescue treatment, including stopping massive bleeding, clearing airways, and decompressing a tension pneumothorax, should be administered. The most severely injured have to be evacuated immediately.